Hi there. This presentation is for the Regenexx SD Phases handout. Please go ahead and take out your handout with the orange boxes and we will begin. These procedures are referred to Regenexx SD. SD stands for same day. That is, whatever blood products we take, either bone marrow or blood, needs to be used within 24 hours or discarded. This is to contrast it to a procedure referred to as Regenexx C. Regenexx C stands for culture expanded stem cells, and this we do in our facility in the Cayman Islands. There we're able to grow the stem cells over a period of time and do genetic testing of those stem cells at the same time. And then approximately 4 to 6 weeks later we're able to use those cells as a way to get the healing we're looking for. In that case, we're able to get up to 1,000 times more stem cells. Today we're going to be speaking about Regenexx SD. Each of these orange boxes that you see in front of you refer to a different day. And as you can see, they're separated out by about 2 to 5 days in between each one. The first box is called the Phase 1 pre-injection. The second box is referred to as Phase 2 re-injection. And the third box is the Phase 3 post-injection. Let's look at each of these in more detail. This would be the start of the procedure, Phase 1 pre-injection. This starts with a blood draw from the nurse, and we mix a component of the blood, typically with a prolotherapy solution, or sometimes with platelets from the blood. The prolotherapy solution is typically a high concentration of dextrose, which is a sugar water, and this has been shown to strengthen ligaments and generally prepare the joint for the stem cells or whatever tissue it is that we're injecting. And we call this analogously tilling the soil. Second phase we call re-injection. There's a morning appointment where we do a bone marrow aspiration, and you'll need to be fasting for approximately 3 hours prior to that procedure. After that, we are able to take the material to the laboratory, isolate the different components that we need, that is stem cells as well as platelets and growth factors. And you would leave the clinic at that point and go have a meal. We'd give you some ice packs on the back of the pelvis where the procedure takes place. And you'd be comfortable enough to be able to go ahead and have a meal, come back in the afternoon once our materials are prepared, and we would re-inject that into the areas of damage. And we call this planting the seeds. Here. This is the back of the pelvis. It's not the spine, it's not the hip joint. We're looking at numbing the skin, numbing all the way down to the bone level. Once you're comfortable, a tool is placed at the site where the bone has been numbed. It will be explained to you that you will feel some pressure, but you shouldn't feel any sharp pain. As we enter into the bone, we'll flush a little bit of fluid through the syringe and then start to pull a little bit of the bone marrow. Usually take a small quantity of bone marrow from each site. As you can see here, there are approximately 3 to 4 sites on each side that will be harvested. This is typically not a painful procedure at all. There's some mild discomfort. There's some aching afterwards that is usually tolerated well and is generally relieved with just ice on the area. Most people fear this more than they should. This is typically not a part of the procedure that people feel much discomfort with. After the stem cells have been should be placed in a brace, usually for approximately 6 weeks while you weight bearing, if it's for a lower extremity, or 6 weeks for other areas as well in the upper extremity. There is some pain that is associated with the re-injection procedure in Phase 2, and we will give you a prescription to help you deal with that pain. Pain is usually approximately 2 to 3 days, and then there's either a quick return to your baseline, or sometimes it takes about 2 weeks, 1 to 2 weeks before you return back down to your baseline. But the intense pain is usually in the first couple of days. Then, a few days later, we'll do what's called phase 3 post-injection. At this point, we're going to have you meet with the nurse again for a blood draw. We will isolate platelets and growth factors and some other agents we'll place in there, and we'll put that back into the structure that is where the stem cells were placed as a fertilizer treatment, or watering the seeds. Okay, back to the main page. You'll see now we're going to move on to this blue box. This usually occurs about 6 weeks later. Let's look at this in more detail. You can see here that it says this is generally for more advanced conditions. Not everybody is required to do this, but if you do have an advanced condition, large tears, severe arthritis, for example, we do recommend 6 weeks later, after the stem cell procedure, having a platelet booster. Now this is a blood draw with injection into the areas where the stem cells were placed. Maybe one injection or maybe several. And now, looking back at the main page again, you'll see a section called Annual Maintenance. Now this is not required for more advanced conditions. We are not curing your condition, especially if it's advanced arthritis. This is not a cure for that. But we're thinking of a really reasonable treatment strategy. And typically, the improvement, I'll explain that at this point, usually starts somewhere around 6 to 8 weeks, and that's the beginning upward slope of improvement in pain and in function. What we notice is that at 3 months, typically you're better. At 6 months, even better than that. At 9 months, even better than that. And typically plateaus somewhere between 9 to 12 months. At that point, you may stay at that plateau for long periods of time. But there is some logic to trying to maintain that plateau by putting a PRP, or a concentrated platelet injection, which we call SCP, into the area that the stem cells were placed, perhaps 1 time a year or maybe 2 times a year if you're extremely active and you want to be very athletic. This is again a blood draw and isolation of platelets and growth factors, and putting in a couple of agents to stimulate a healthy environment within the joint to try and maintain the benefits of the stem cell procedure you had. One other box to quickly go over here is this red box here. It's called range of motion. Sometimes we call it capsular distension procedure. This usually applies to conditions in which there's advanced hip arthritis or advanced shoulder arthritis, especially in cases in which the range of motion has been severely limited. It's usually going to occur about 3 to 6 weeks prior to the phase 1 orange box, the pre-injection that we discussed earlier. What we do is we isolate platelet growth factors from a blood draw. There's various ways to do this. Some of the doctors typically will add hyaluronic acid, which are similar to the gel shots that you may have heard of for knee arthritis, and an anesthetic that we know is a safe anesthetic for joints. There may also be a nerve block associated with this. So the purpose of this is twofold. One is to try and improve the range of motion, so we put a lot of volume into the joint and try and stretch it from the inside out. And the numbing solution in the joint, in combination with the numbing solution from a nerve block, will allow us to manually stretch that joint and try and improve the range of motion. And it's not uncommon to get several degrees of range of motion in every direction greater after this procedure. Additionally, having placed the platelet growth factors into that joint with the hyaluronic acid several weeks before doing the stem cell, we find that the stem cells have a better environment once we get to that point of the process. It's important to understand that an arthritic joint, especially in advanced arthritis, especially in the hips and in the shoulder when the range of motion has been decreased, is a very harsh environment. Stem cells do not live or do not do well in that environment. They don't grow very well. So we're trying to set up better soil, set up an environment that's better for them in advance of our stem cell procedure. creates a better environment for the stem. Back to the main page, you see at the bottom there's a section referring to pre-medication and peripheral nerve blocks. Let's look at. You have an option of obtaining, we will prescribe an anti-anxiety medication, sedative, if you desire. That may make the procedure go more smoothly for you. However, you would be required to have a driver if you were to choose to go that route. The pre-medication may not be needed for all the parts of the procedure, perhaps only for the bone marrow procedure and the re-injection in phase 2. That's optional. There's also the possibility we may offer a nerve block for certain conditions and for certain procedures. The nerve block may result in weakness in that extremity, or may result in just a sensory nerve loss. And this is temporary for a couple of hours. If we do a nerve block that ends up weakening the lower extremity, for example, we would require that you not place any weight on that extremity for 4 to 5 hours. However, there are other nerve blocks we can do that are just sensory, that do not weaken the extremity. It just depends on the condition, and that is an option. Of course, you would need a driver for that, especially if it's a lower extremity, but in the cases of an upper extremity like a shoulder, it would also be a good idea to have a driver. Let's go to the second page and start with the top section called medications. We have been able to identify that certain medications interfere with the stem cell's ability to grow. This is based on researchers' data as well as internal research data by Regenexx. I'm going to go over some of the common ones here. Many people are on anti-inflammatory medications like Motrin, ibuprofen, Advil, Aleve, Celebrex, Mobic, etc. If you're on that on a daily basis, we have been able to identify that decreases our overall outcomes. So we would like you to have a washout period. That is a period of time where you're not on that medication prior to starting the bone marrow procedure. So you can see here, if you're on that regularly, then we would like you to be off of that for a minimum of 4 to 6 weeks prior to your bone marrow procedure. And then we would like you to stay off of that for about 6 to 12 weeks after. If you're not really taking it very often here and there, then you can wait maybe about 2 weeks before you have the bone marrow procedure. You see the next section here is steroids or cortisone. These are very potent substances that have a very negative impact on stem cells. They tend to, we think, kill the stem cells, especially in the local area they've been injected, or they can decrease your stem cell counts. So if you've had a steroid injection, we'd like to wait at least 3 months since that last injection before we do the procedure, even if that injection was done in a different body part than the one where we will be treating with stem cells. And that's the same as if you were to have a course of oral steroids as well. If you're using inhaled or nasal steroids, ideally we'd like to wait 6 weeks before we do our procedure. If it's a topical steroid, if it's very small quantities, we're probably okay, but if you're using it over large skin surfaces, then we probably want to have that same sort of time where you're off of that medication. Okay, other medications that are common are the statin medications to lower cholesterol. We have been able to identify that this inhibits the growth of the stem cells. We would like for you to be off of the medication for 4 to 6 weeks prior to the bone marrow procedure, and at least 6 to 12 weeks after. Of course, you're on these for a reason. Your doctor has prescribed them, and you would need to work with your doctor on coming off of these medications. We can provide alternative options for you that may be that are okay as far as our procedure goes, and may also help your cholesterol at the same time. Additionally, there are certain blood pressure medications, not all blood pressure medications, but ones that are of a particular category. You can see these are called ACE inhibitors, or ARBs is another one, angiotensin receptor blockers. Some of the brands or medication names are lisinopril, napronil, Cozar, etc. These we believe have a negative impact on stem cells based on our internal research. 4 to 6 weeks after stopping that before you have your bone marrow procedure, and 6 to 12 weeks afterwards. Again, you need to work with your prescribing doctor. We can provide alternatives for you. I won't go into all the different blood thinners here. You can see on the next page. But aspirin, if you don't really have to be on it, we'd like you to be off of it for 4 to 6 weeks. If you're unable to discontinue it due to your serious health condition, perhaps the prescribing doctor would be okay with you being off of it for 3 to 5 days prior to the bone marrow procedure. Coumadin, if you're on that, it's for a serious condition, but we may need you to stop that for 6 days prior and be on something called a heparin window, and you would be required to do that with your prescribing doctor. Plavix is another common blood thinner. We would like you off of that for 6 days prior. Again, your doctor would need to approve that. Next section here are supplements. There are a variety of different supplements that we've been able to find that help stem cells in various ways, either create an environment that is healthier for the stem cells, perhaps they help stem cells growth or protect cartilage, or in some instances push stem cells in the direction of cartilage. Since stem cells have a choice which way they can go, there are different signals that can help them move in one direction or another. So your doctor will review your particular condition and check off the boxes here that apply to you and provide their recommendations at the time of your appointment. Those supplements can either be purchased in the office or online at the directions you have on the next page. Additionally, we are very concerned about getting the healthiest stem cells we can from you. This is unlike a drug that we get off the shelf. We are obtaining the stem cells from you. When we do that, we have equipment that and a machine that actually measures the total quantity of stem cells you have, but also what percentage of your stem cells are alive. Some people have 95% alive stem cells, but other people have 75% alive stem cells. So we're trying to identify all the different variables that may help increase not only your total number of stem cells, but also what percentage of them are living. And we believe that nutrition is a very, very important part of this. So we recommend that every stem cell procedure, the patients receiving this procedure, in advance of the procedure, make some lifestyle adjustments in the way that they eat. Almost everybody can improve what they're eating, and we recommend that you work with Paulette Weber, who's a registered dietitian, whose information is on your sheet, is on the screen in front of you. She will talk to you about what we think is a healthy food plan for stem cells. And by the way, that's going to be healthy for pretty much all conditions. Generally speaking, it's going to be lower carbohydrates, low glycemic, that is low sugars or no added sugars. It's going to be high intake of healthy fats, things like avocado and certain fish and nuts and seeds, coconut, olive oil, and it's going to be moderate amount of protein, typically from plant-based foods and fish. We like to keep animal meats in general low in this diet. So we recommend that you meet with her. You can do this by Skype or by phone, and you can contact her at the number there. Physical activity is the next section. It's very important that you remain active. We want you to be active. The more active you are, the more active your stem cells are. So if you remain active but have a lot of pain, that's something you need to consider. So we'd like you to try and target a minimum of 150 minutes per week of an aerobic type activity that doesn't cause you more than 2 out of 10 pain. So most people can find something. Even if you're in a lot of pain, you may be able to do swimming or a recumbent bicycle or an elliptical machine. But that activity is an important part of this, and we'd like you to do that in advance of this procedure. If you're already very active, then continue to do what you're doing. You'll see a section about physical therapy. That's something we will order for you that will be paid by your insurance. that can be done local to you, we will provide a prescription for that, and we will provide them with a rehabilitation protocol so that they can rehabilitate you over the course of approximately 6 weeks. You will be moving around and using the extremity or whatever it is we're treating immediately, but we want to ramp you up to full activity over approximately 6 weeks. It may take a little longer or a little shorter depending on your particular condition, but we will provide that protocol. You can see there's a section on stress and sleep and anxiety and depression, as well as on environmental chemicals. I recommend reading that on your own on your paper. Alcohol and marijuana. We'd like marijuana avoided. Marijuana seems to push stem cells in the direction of bone, which is generally not what we're trying to achieve, although there are times where we will be injecting into bone and trying to get that to strengthen. And alcohol generally is toxic to stem cells. We'd like you to avoid that, but a glass of red wine a couple of times a week with dinner is not really a problem. Tobacco is a problem. We really feel that it's important that you stop smoking. We know that smokers do not heal well, that require more treatments than other people, and overall you would be creating a negative overall impact on your results if you continue to smoke. Next section is hormones. Men may want to consider having their hormones tested. Testosterone levels that are low create an environment that is typically considered to be a non-healing environment, whereas mid to upper range testosterone levels create a growth and healing environment and can overcome some of the breakdown that's occurring in the tissue. So we think that's synergistic with what we're doing. In the handout I provide some blood levels of testosterone for men that we think would be ideal, and it's also important to check estrogen levels at the same time. Estrogen tends to be have a negative impact, especially if it's in higher amounts, and would recommend a certain range, approximate range that's in your handout. We will not be the ones prescribing this to you, but there are a variety of doctors who have become very skilled at doing this. If your primary care doctor is not knowledgeable about this, we perhaps can recommend somebody in your area who might be. The same goes for women. We recommend consideration of blood testing or urine testing of your female hormones, especially if you're postmenopausal or perimenopausal. If your levels could be improved with supplementation, then we would recommend possibly using bioidentical hormones to get there. It's generally important to have testing of this and to use bioidentical hormones as opposed to synthetic hormones. Again, we can recommend somebody to you. And the last section on this page is bracing. We often recommend braces following the re-injection phase. We want to protect the area for approximately 6 weeks. If you're weight bearing, then we would expect you to wear that brace for 6 weeks while you're weight bearing. However, you can take it off for sleeping or while you're on the couch, etc. We will order that brace for you typically through a vendor who will contact you and work with you directly on trying to get that covered through your insurance. That may or may not occur. Some insurances reject braces for certain conditions, others don't. But we will have the vendor work with you on that if that is your scenario. Okay, if you have any questions, please do not hesitate to contact our office. In particular, Ariel, who is one of the Regenexx liaisons. We have other liaisons as well. You can consider emailing at that info@newregen.com. The Regenexx liaison will reach out to you and get you started on figuring out a schedule that works for you and for us and that matches all the recommendations that we're making. And our main phone number is there, which you have in your paperwork, and we look forward to working with you. Bye-bye.